Hi, welcome to the Valerie Gehy Health Insurance Podcast, where we empowering you one policy at a time. On today, episode 3, we are going to discuss about the importance of the network providers. We are going to address the common misconception, such as pre-existing condition, and also tips on selecting the correct plan for you. So here we go. What are the importance of the network? It is highly important because it is based on who you're going to see, who is part of the network, your favorite doctor, or are you willing to go where the plan takes you? So that's really the common ground when it comes to network providers. We do have the HMO and we have the PPO. The HMO, basically, you have to go where the plan takes you. You do need a referral when you require a specialist from your PCP, which is stand for primary. And also the PPO, you don't need a referral to see a specialist, and you have the largest network. You have the largest network, so you don't need any referral to see a specialist. Now, here's the question: are you willing to go with a selective network, or you don't want to deal with that and you want to have you want to be able to select your own? Of course, the largest network is Pricely, and the HMO is the least expensive, of course. Now, what I would suggest, if you are a 28 years old, if you are 19 years old, you have no pre-existing condition, you are in perfectly healthy state, you just go to see your doctor once a year to do your preventative care. Why not go with an HMO? Literally, because first, it's gonna cost you less. Second, it's only one time a year, so it's okay to have an HMO. But if you do have any pre-existing conditions such as the cancer, heart disease, those are those are the conditions that would highly recommend a larger network. Why? Because you need several diagnostics, you need several opinions, you need to be able to make your own choice by having different diagnosed by different providers. So that's why I would recommend, where to go, which is it HMO or PPOs. I had a perfectly experience with HMOs. Why? Because someone like me that is busy, I do not have time to go research about doctors, to go research about their reviews. They are, kind. And I would I would prefer that the carrier just tell me, hey, Valerie, go here. So that's the referral. So those are the people that do not have the patience to research about doctors or to know exactly and go over the reviews. Then the HMO is perfectly for you because they tell you where to go. You don't need to research. But if you have the patient also to research about doctors, or you have a condition that you inquire to research, then yes, the PPOs will fit the purpose, will be more suitable to you. Um, of course, more money with PPOs, less money with HMOs. Now, the misconception about pre-existing condition. That's very important. There is two kind of plan in this country that most likely cover the pre-existing condition. It's either you are under a government plan or you are under a group plan from your job. Period. There is no way around it. Under a government plan or under a group plan from your job. Yes, those two most likely will cover your pre-existing condition. With the government, you're protected by the Supreme Court law, very similar to Medicaid. You will be covered for any pre-existing condition. And when I said any, I'm talking about cancer. I'm talking about heart condition. I'm talking about diabetic. I'm talking about hip replacement. They have to cover you by law. When you under a group plan, of course, the employer will negotiate with the carrier to cover that as well, because it's for the benefit of the employees. So yes, you will be most likely covered with your pre-existing condition. Remember, always refers to the deductible, because the deductible will kicks in when it comes to tests beyond your preventative care. Preventative care, most likely, whether it's a government plan or your group plan, most likely for both will be completely covered at 100%. And what am I saying? Preventative care, blood work, lab work, colonoscopy, mammogram, those are the preventative care. It's to prevent your body to collapse. It's to maintain the good state of your body. So that's preventative care, a prevention for collapsing, a prevention of pitfall. So prevention, it's always most likely 100% at no cost. But when it comes to tests beyond, let's say, as you're doing your preventative care and they find a little something, an abnormalities, they need further tests, such as an MRI, then yes, your deductible will kicks in, because now we fall into the co-insurance. Co-insurance versus co-pay. Now, those two are very different, they're very complex. Co-insurance is a percentage. It fluctuates upon the total cost or the provider's cost. The copay, it fixed flat, so you don't pay a percentage. So most likely when you have to see a specialist, gynecologist, dermatologist, cardiologist for your heart. Those are copays most likely will be varies, which is $30. So it is fixed, flat, no more than 30. But when you have to do an MRI, if your co-insurance is 25% of the total cost. Okay. That is fluctuate. That is very important. Now, what are the tips when you select a plan? Of course, how much I'm going to pay, what is my deductible, what is my maximum out of pocket, and how much is my coinsurance. Boom. 4. What is my deductible, how much I'm going to pay, what is my maximum out of pocket, what are my copay, and also what is my coinsurance. Okay. Be equipped with your information. If you have a doctor that you don't want to change, the agent on the other line will not know. You have the responsibility to provide that information to your agent. Valerie, I have this specific doctor. The name is boom boom. Correct spelling, please. That plays a major role. Correct spelling of your doctors. I do not want to change. Yes. On the other line, the agent has the due diligence to make sure that plan covers your doctors. Now, let's say you have several conditions and you have to see this specialist, this, but I have people that have 6 specialists. Most likely one plan is not going to cover the 6 specialists. Okay. So we can discuss about that. We can say, okay, the this carrier covered 3 of the specialty. Which one you are willing to change? We can discuss about that too. I know my ladies, if it's like me, I do not want to change my gynecologist, because once that gynecologist is used to that body, most likely, you would not want. So the gynecologist, most likely you don't want to change. But are you willing to change your dermatologist? Are you willing to change your cardiologist? It's up to you. So now we are going into a discussion. Provide me the information so I can provide you um, on my hand, so I can help you select the correct plan. Okay. So that's why the purpose of this podcast, for you to be empowered with information, for you to be more savvy when you talk to an agent. You just don't call, you don't grab your phone. Okay, today I'm gonna take care of my health insurance. No, no, no. What do I have? What do you want I want my health insurance to cover? I want my insurance to cover this specific doctor. I want my insurance to cover this specific medication, the specific milligram. I want to know how much is my deductible. I want to know what is my copay for specialist. I want to know what is my maximum out of pocket for the whole year. I want to know, are my preventative care all covered at 100%. So this is what information do to you. When you call, you calling, you have more confidence, because you know exactly what you want. So you delegate to the agent for the agent to execute your delegation. Period. So you call with the knowledge, and we are here to execute your demands. So this is the tip. So now keep in mind when it comes to government plan, it is upon income. More money, more problem. The more money you make, the less help you get by the government, and the higher is the premium, the higher is the deductible, the higher is the co-insurance, and the higher is the maximum out of pocket. This is the world we're living. We don't make the rules here, we abide by the rules. More money, more problem. Now, okay, so yes, when it comes to group plan from your job, now it's a negotiations from the employer with the carrier to set in stone. There's most likely two plans. They will have one if you want to go with the higher deductible and the group plan from your job, and they have one if you want to go that's literally more, a little bit slightly more expensive if you want to go with the less deductible. Okay, that is under the group plan. It's already negotiated for you. You have nothing to do. It's like it's framed for you already. So there is nothing you can change. It's not upon your income. It is set in stone. It is what you're gonna pay because the employer already negotiate that plan between them and the carrier. So those are the plan. But when it comes to government, it's fluctuate. Why? Because it is upon your income. It is upon your size of your family, your household income. It is also upon your demographic. Okay. So for an example, in Florida, the state minimum income for a single person in Florida for you to be eligible, it varies between 16,400. That's Florida. When it comes to Louisiana, the minimum income is 20,400. Why is that? It's different state, different demographic. Okay. Um, another question: a family of four, that makes $50,000 will be qualified for a state subsidy. A family of four that make 30,000 in Louisiana will not be qualified because they have to make the minimum income, which is 38,000 for a family of four. So those are the thing it's the demographic plays of factors as well, um, into the premium, into the deductible, into the maximum out of pocket, and into the co-insurance. Income. What is the household income? If you're single, what is your projected income for the year? More money, more problem. Um, and also, if you also pay more than 10% for your plan and your employer, you can choose to go under the ACA. You can choose, but only if you pay more than 10%. What do I mean by that? Let's say your income is $3,000 a month and your premium for your health insurance is 310. That is more than 10%. Then you can choose to go under the ACA only if it's more than 10%. Okay. Other than that, we can weigh your options also. You can say, Valerie, this is how much I have to pay if I go under the group plan for my job. Let's go over your income to compare which one it will be better for you, if the ACA will be better or the group plan will be better. Those are the information that you need also to be smarter, to be equipped when you call your agent. So I hope today you were able to learn. This is the whole purpose, the profound purpose of this podcast, to make you smarter, to equip you with the information. So when you talk to your agent, you don't take anything from them, you delegate and we execute. You call me. I hope I am your agent, of course. You're gonna call me and we're gonna discuss what is suitable to your circumstances. Don't forget, I'm gonna be here every week to just pour it all to you, to make you smarter, to educate you, to provide you anything, any misconception, any question. If you have, don't forget to provide me the question as well. So for future upcoming episode, we are going to make it more spicy. We're going to have some guests. We are going to have providers. You are going to be able to ask questions. We are going to have testimonials. We are going to have agents like me, my colleagues. What do they face on their hand? So you're going to be able to compare and analyze. So don't forget, if you have any question, go on my website, valeriegehy.com. Provide me the question so I'll be able to answer your question in the next upcoming episode. All right. So don't forget to share. Don't forget to subscribe. And remember, we are empowering you one policy at a time. Bye bye now. See you in the other line. Bye bye.